So again, welcome everyone. Thank you so much for joining us this morning for JDI's Legislative Briefing. And I'm going to turn it over now to Deborah Robin, who will welcome us with some opening remarks.
Thank you, Adrian. Good morning, everyone. My name is Deborah Robin. I use she, her pronouns, and I am JDI's proud executive director. Thank you for being here today. We miss you in person and are really appreciative of you showing up this morning. And we have quite a large gathering, so that's amazing. Today, we're excited to share with all of you our legislative priorities and the frameworks that set the foundation for our advocacy. You will also hear directly from some of our member programs and their individual and collective experiences working with survivors of sexual and domestic violence, especially in the past year. Jane Doe Inc, JDI, is a statewide membership and advocacy coalition. We work at the intersections of gender-based violence and racial justice. Our 59 member programs are located in every city and town in Massachusetts, spanning cities, towns, rural communities, and islands. Their geography, the breadth and depth of diverse survivors' experiences compel all of us to consider the complexity of meeting survivors where they are and creating responses that are relevant and inclusive of their many lived experiences. In this past year, living through the public health pandemics of COVID and racism has brought to the surface all of the disparities and inequities that have always existed, but have been so much more exacerbated. We witnessed our member programs pivot into remote services practically overnight, reinvent their advocacy work to adapt to the ever-changing landscape, and support their staff and their communities. Their capacity to do this is a reminder of the persistence and resilience that defines their commitment and passion for supporting survivors. The needs of survivors are vast, including the basic needs of housing, food, economic security, addressing the barriers created by language-based marginalization, trauma, and the critical need for safety and healing. And you will hear more about these issues today. Today is also about acknowledging and appreciating the community that we all share and coming together to have these discussions and considering what solutions are needed to make so many needed changes in systems, policies, and access to resources. We are deeply grateful to all of you for the ways in which so many of us have come together, especially in the past year, to work towards equity and justice for survivors. I want to thank our member programs, our panelists, and the many legislators and aides who are with us today. And I also want to take a moment to thank some of our amazing champions in the legislature. So a huge shout out and thank you to our champion legislators, Senator Sonia Chang Diaz, Senator Harriet Chandler, Representative Blay, Representative Tram Nguyen, Representative Natalie Higgins, and a grateful thank you to our campus sexual assault lead sponsors, which brought that 6-year effort to a law this year, Senator Michael Moore, Representative Tricia Farley-Bouvier, and Representative Lori Ehrlich. Last but not least, I want to recognize the incredible leadership of JDI's policy team, who you will hear from now, Hema Sarang-Saminsky, Policy Director, and Adrian Rancher, Policy Coordinator. Thank you so much for being with us today.
Good morning, everybody. My name is Hema Sarang-Saminsky, and I'm the Policy Director at JDI. We're going to pause a little bit in between to make sure the spotlights switch. There we go. We're practicing good accessibility practice at JDI. Thank you so much, Deborah, for those opening remarks. And I echo the deep, deep thanks to each and every one of you here taking the time to hear about our work today. This was really the purpose of this briefing, to share the experiences of our programs and to let you know why and how we do the work we do. So I'm here to talk about our policy frameworks and priorities. You heard from Deborah about the disparities that emerged as a result of the pandemic and that continue to impact survivors. At JDI, we know that working to end sexual and domestic violence is fundamentally intertwined with working to end these disparities. So this is at the core of our mission and vision in our coalition's work. So when we approach our policy framework, we do so through this lens that centers the needs of survivors of sexual and domestic violence, all survivors, and incorporates an analysis at the intersections of racial equity, economic justice, human rights, education and prevention, and access to safety and justice. I'm just going to spend the next 15 or so minutes just walking you through each of these areas and sort of to give you a sense of why a sexual and domestic violence coalition approaches our work through this intersectional framework. As you see from the slide, at the center of all of our work are survivors. That is really what motivates and guides the work that we do. But I want to talk about each of these pillars of our policy work. So I'm going to start with racial equity. Racial equity because JDI understands that the root cause of sexual and domestic violence is oppression in all of its forms, including racism and white supremacy culture. This means power and control. And so we know we can't challenge the abuse of power in the context of sexual and domestic violence without also challenging the abuse of power and control by some institutions and systems and individuals against BIPOC communities. And I'm going to use that term throughout this presentation. BIPOC means Black, Indigenous, and other people of color communities. Moving to economic justice. Economic justice is critical because economic abuse can be used as a tool to disempower and trap survivors in abusive and unsafe situations. So we support a broad range of policy and legislative changes to promote economic stability for survivors in so many ways, from affordable housing access, access to basic benefits, employment protections, and more. Moving to education and prevention. Education and prevention is central because ending sexual and domestic violence means teaching youth and building community understanding about healthy relationships, healthy sexuality, consent, and celebration of our identities, as well as an understanding of sexual and domestic violence, its dynamics, and how to find support when experiencing harm. We need funding for prevention, and we celebrate the Healthy Relationships program that is beginning to pave the way for that. Human rights. Human rights is critical because access to safety and support isn't equitable. Immigrant communities, LGBTQIA+ communities, incarcerated people, sex workers, people living with disabilities, and so many others are targeted for violence and face so many more barriers to support, safety, and healing. We acknowledge this, and we hope to cultivate partnerships with those who are most impacted by these forms of intersecting violence. And we support policy initiatives that promote the well-being and safety of these communities. And now access to safety and justice for survivors. As a coalition, we understand that how systems respond to survivors can often make or break a survivor's willingness or ability to seek help. So to this end, we prioritize legislation that ensures systems are both responsive and accountable to the complex needs of all survivors. So that's just a kind of a walk through the rationale for how we choose our legislative priorities and agenda and our systems change work. We hope that sets the stage for how we do the work we do. And we really invite you to engage with us on these issues. We think of this in an intersectional lens. So this past year has been a transformational one that was fraught with so much pain and loss for so many of us. And also the hope in the power of community and solidarity to rise up against injustice, to rise up against white supremacy, and in support of Black lives Following this theme as a coalition, we've begun to do some of our own work, our own reckoning. And we've begun to come together. We've started to take a deeper look at our own reliance on criminal legal system responses as primary responses to sexual and domestic violence. We've begun to ask ourselves what that means for survivors of color, transgender survivors, and other marginalized communities. You know, this is a conversation that is happening in coalitions and sexual and domestic violence coalitions across the country. And it's time to have those conversations. So for too long now, so many of us in this field have known that the advice that safety is found through a call to 911 is sometimes inapplicable or even unsafe for too many survivors. And so we want to deepen these conversations. These aren't easy or simple, and in many ways they are just beginning, but I am grateful for them and really hopeful for your openness to engage in these conversations with us in the future. So I want to talk a little bit about where these conversations have taken us thus far. As a coalition, we sit in these middle spaces with an eye towards both social change and harm reduction within existing systems. So to that end, we've talked about the positive outcomes of our partnerships with law enforcement and other systems, the relationship building and increased understanding of sexual and domestic violence by system actors. We've started to look more honestly at the reality that many survivors can't and don't feel safe relying on these systems. We've identified opportunities for change, including policing reform, and led the perspective of why policing reform is important to survivors. We're beginning conversations on what community-based strategies for support and accountability might look like. We've spoken out on the realities and needs of people who are incarcerated, so many of whom are survivors. And now we're looking critically at the impact of child welfare systems on survivors and communities of color. These are the range of perspectives we bring into our systems change work every day. And we're so grateful for the opportunity to bring this survivor-centered social justice lens to so many tables, Zoom tables right now, geared at improving system outcomes. And we thank our system partners for being open to those conversations and making space to have those. So now, our legislative priorities. But it felt important to ground us in the why we do the work we do piece here, both for our legislators and our member programs and all of the incredible advocacy that happens across the Commonwealth. We wanted to ground you all in the why we do this work the way we do. So first, under education and prevention, it's time to pass the Healthy Youth Act. You know, educating youth on how to identify and have healthy, respectful relationships, free of abusive behavior, and understanding of consent that is critical to preventing and ending sexual and domestic violence. We're also excited to support an act relative to safe schools. We have increasingly begun to take a look at the impact of youth survivors in the school setting. And we see that prevention, education, and supportive services, rather than policing, are really what young survivors need in the school setting to get the support they need and to promote healing. Towards uplifting racial equity, we want to highlight language access this year as a critical issue that is really at the intersection of survivorship and racial equity. We are supporting an act relative to language access and inclusion. Survivors need comprehensive, trauma-informed language access. No one should have to wait hours for an interpreter when trying to seek a protection order or navigate a system that was designed to provide benefits to survivors. At JDI, we'll be launching a survey very soon to better understand these realities for survivors that our programs work with. And we're very pleased to support this legislation and work. Next, we want to highlight a direction that, you know, as a coalition, that we're beginning to engage in some learning around. And we wanted to highlight an act supporting survivors of trafficking and abuse and encouraging increased access to opportunities through expungement or sealing of records. I'm going to call this the Expungement and Sealing Access for Survivors Bill. So with our partners, Pauline Carrion at Greater Boston Legal Services, JDI is thrilled to have filed this bill as we begin these conversations about the many ways that we can work as a coalition to decriminalize survivorship. And what that means is that too often, survivors are criminalized or enter into criminal systems for what they did in order to survive. So that might be substance abuse or trade, it might mean sex work, it might mean economic crimes. But criminal histories make access to jobs and housing far more difficult for survivors. And this bill expands the options to expunge or seal criminal records without a waiting period for survivors of sexual assault, domestic violence, and human trafficking. Next, we move to economic justice and security. JDI prioritizes, as I mentioned earlier, a range of legislation that will promote economic stability for survivors, from affordable housing to employment protections and more. Some highlights that I wanted to lift up: an act to lift kids out of deep poverty. The economic impact of surviving abuse is significant, and LIFT is one step towards supporting those most impacted by poverty by raising cash assistance levels to 50% of the federal poverty guidelines. We also, in the category of economic justice, wanted to shine a light on the realities of employment discrimination and barriers for survivors, for so many survivors of sexual assault and domestic violence. Survivors face many, many barriers to securing and retaining employment. So requiring employers to provide reasonable accommodations and prohibiting discrimination is really one way to promote just and trauma-informed workplaces. So this is why we're supporting an act relative to employment protections for victims of abusive behavior. Moving on to our last two categories, but certainly not least. In the category of human rights work, we wanted to uplift today the Safe Communities Act. You know, immigrant rights are survivor rights, and it is also very much time to pass the Safe Communities Act. Immigrant survivors need to know that they can access safety and support without fear of immigration enforcement, period. Also, you know, as we begin to look at the unique needs of incarcerated survivors, an act to ensure compliance with the anti-shackling laws for pregnant incarcerated women came to our knowledge. And we want to uplift the reality that 86% of women in prison are survivors of sexual or domestic violence. And when I say women in prison, I include women and all women. Shackling pregnant people prior to, during, or after birth is deplorable, and we need legislation to enforce existing prohibitions. Finally, I want to talk about access to safety and justice. And these are three pieces of legislation that are designed to improve system responses for survivors. First is an act improving protections for sexual assault survivors. JDI is excited to file this legislation with the support of many partners, including some excellent conversations with the Victim Rights Law Center. It has been 10 years since 258E, which is Massachusetts Sexual Assault Protection Order, was enacted. This bill adds trafficking as a basis for relief. It creates some incredible and necessary fixes by bringing aspects of this bill to have greater conformity with 209A protection. And it also affirms a judge's ability to really create orders that ensure the safety of a survivor as the survivor feels is necessary. Next, in terms of these fixes and system improvements, is an act promoting safety for victims of violent crime and human trafficking. You know, this bill really creates consistent expectations, transparency, and clarity for survivors and for law enforcement, as survivors are seeking certifications from law enforcement agencies in order to apply for some immigration benefits like the U or T visa. This creates clarity, a timeline. It's a simple fix. Finally, we're really excited to be partnering with Mass Law Reform Institute and other community partners to file an act protecting survivors of domestic abuse from abusive litigation. So this bill gives judges additional tools to stop the misuse of the court system to further tactics of abuse of power and control. This is a common scenario we've heard of quite often over the years. It can be called abusive litigation or court abuse, and these tactics can force a survivor to appear repeatedly in court at their own emotional or financial expense. So, as I mentioned, I just want to share deep gratitude for all of the co-sponsors of these bills, for the legislators who have supported us as we've developed and filed some of these bills. These are just highlights from our legislative agenda for this session. We really ask that you take a look at our detailed list of priority and supporting legislation, and to know that our supporting legislation list grows significantly over the session. So please approach us and talk to us if you want to hear and have conversations about the intersection of survivor issues with legislation that you are considering supporting. We're always here to answer questions, so please do reach out. And with that, I'd like to introduce Adrian Rancher, our policy coordinator, to share a few words on our commitment to civic engagement.
Thanks, Hema. I'll give it 1 second to make sure I'm spotlighted. Okay. So thanks, Hema, for introducing us to our framework and going through the many number of priority and supporting legislation we've already built in just the past 3 months or so. So I want to just chat a little bit about civic engagement and what that means for us here at JDI and the conversations we're starting to have with our member programs. So civic engagement is something that's become increasingly important part of our work at JDI. And we've always encouraged our member programs to be engaged through the legislative process, the budget process, sharing action alerts and different ways that you can be involved in that sense. And as well as during election years, making sure that we're uplifting voting resources and reminding folks to register and when voting day is. And it's very easy for us to just define civic engagement in that very political or legislative process. But for so many reasons, we know and we've realized that these forms of civic engagement aren't accessible to everyone. And it also just may not be a comfortable way that everyone feels engaging in the civic engagement process. And so at JDI, we've really started to have these conversations to think a little bit more about what this quote unquote informal or non-traditional civic engagement looks like. And what we've seen is that we've started asking ourselves the question, as well as asking member programs, well, what does civic engagement mean to you? And what does that look like for you in your communities? And I really encourage folks to actually think about that question and think about how that applies to you. And if you are so moved, please feel free to share your responses to that question in the chat. But what we have found through our conversations at JDI is that civic engagement really comes down to community engagement. It's the ways that we interact with our communities, the ways that we show up for one another. And we're talking about our local communities, right? We're not talking about needing to be involved on a state level in these very formalized ways. But what are the little ways that we continue to show up for each other and build community? And what's really powerful about framing civic engagement as community engagement is that we're really centering the grassroots nature of civic engagement, really recognizing the collective power of individuals when we're able to come together. And through those conversations, what we've also found is that an essential piece of that community engagement is about education and sharing knowledge and that common grounding that we all have in our community when we're able to come together. And that really empowers us and helps us to uplift one another and amplify each other's voices. And through that, we're able to build that collective power and then bring about social change and systems change, which is really what JDI, through our policy framework that Hema discussed earlier, is really what we're working towards, right? And so, as I mentioned, really looking at civic engagement, part of that is building collective knowledge and building collective power through that. And that's part of what we're doing here today. Yes, it is a legislative briefing, and it's an opportunity for us to connect with our legislators and their staffers and share what we're interested in. But we're also learning from one another here today. We've been able to share with you how JDI approaches our policy work from a very social justice lens, really centering survivors who are at the intersections of oppression as well. And so this is an example of civic engagement that may or may not be typically termed that. And I do want to also acknowledge all of the engagement that happens behind the scenes. It's not just JDI, Hema, and myself sitting and making these decisions. It's really by way of conversation with our member programs and by way of speaking to folks at our member programs, hearing from survivors what is happening, what are the issues they're really facing, what are the problems in your communities, from Western Mass to the Cape and Islands, Boston, everything in between. What are the regional differences? What needs to be addressed? What needs to be our priority then? So really even looking at how our legislative agenda and budget agenda comes together, it's through a civic engagement process. It's through these conversations and these collective learning opportunities. And I also do really want to acknowledge that SDV programs in themselves are very formalized and professional ways they are engaging in civic engagement. These are critical programs located in their communities, serving their community members. And through that work every day, that is a form of civic engagement. And you all, as SDV providers, you're engaged in the civic engagement process through attending events like this and in the meetings that you have with your legislators, but also recognizing that SDV programs in themselves are a hub for civic engagement and community engagement in their communities through the different events that they do, through the connections and the outreach that they provide to their community and the services that they provide. That is community engagement. You're building a community right there of people who have a shared knowledge and can empower each other. So I really just wanted to recognize that and help us start thinking about all these different ways that civic engagement happens in our everyday life, but we may not necessarily name it as such. And just again, want to recognize that all of this would not be possible without the investment of these programs and recognizing the really important and critical work that can happen in our own communities when we're actively involved in them. And so with that, I am going to turn it back over to Hema to talk to us a little bit about JDI's budget priorities for FY22.
Thank you so much, Adrian, for uplifting the incredible community organizing work that this movement, this community is engaged in, and I appreciate that. So I know we're eager to get to our panelists. I just want to do a couple notes on budget. You know, the investment that this legislature made in sexual and domestic violence services for FY21 was really, truly, it was life-giving amidst an incredibly challenging time. And I am so grateful for the legislators here and all those behind the scenes who heard our programs when they talked about the impact of the pandemic, when they talked about the increase in demand for services, the complexity in delivering services during this time, and all of that on top of existing needs that were significant prior to the pandemic. And I want to thank the programs, to all of the advocates, to all of you who shared those stories, and encourage you to continue to share those stories and uplift why investing in sexual and domestic violence services is so important. For FY22, we are asking the legislature to maintain level funding for sexual and domestic violence services to DPH line item 1130, 4513 1130. This line funds rape crisis centers, domestic violence residential programs, community-based programs, intimate partner abuse education programs, child witness to violence, and so much more. And you can see a description of what this line funds in your packet as well. So I just want to say thank you. You're going to hear more from programs about, how this pandemic impacted services and what their vision is for the future. But I just want to say thank you to all of you. Thank you for trusting in the expertise and wisdom of local community-based programs. Thank you to our programs and the advocates for your tireless work and for sharing your stories. And with that, we are thrilled to present our amazing panel of speakers today. And I will turn it over to Adrian. Adrian is going to be sharing, introducing the speakers, but we do want to note that unfortunately one of our speakers was not present, was not able to be present today. And so we will be uplifting the issue of sexual assault throughout Sexual Assault Awareness Month. And so stay tuned for further offerings from JDI about how we can continue to connect with the needs of sexual assault survivors. So with that, I'll turn it over to Adrian.
Thank you, Hema. So yes, what I think this is the most exciting part of our briefing today is getting to hear directly from sexual and domestic violence service providers and really hearing firsthand what they're experiencing. So I just want to briefly introduce 3 of our panelists today, and I'll encourage them to introduce themselves as we answer a couple of questions. But today we have Dawn Soma, who is the co-ED of ATAS, which is a statewide culturally specific DV organization working predominantly with folks who identify as Asian. We have also Carmen Nieves, who is the executive director at Women's Shelter Compañeras, which is a domestic violence agency located in Holyoke. And we also have Karu Pitch, who is the executive director at Harbor Cove, which is also a domestic violence agency working in the Chelsea area. Our 4th panelist was going to be Gisela Zuniga, who is the associate director of the Center for Women and Community located on the UMass Amherst campus. Unfortunately, Gisela was not able to join us this morning, but we will be, as Hema said, lifting up sexual assault throughout April, which is Sexual Assault Awareness Month. And we also, Gisela shared a couple of remarks with us that we will also be uplifting today during the panel to ensure that her voice is present. And I also have a short 2-minute video that I want to actually start off sharing, which is from the Center for Women and Community. So with that, I will share my screen briefly and share this video from Gisela.
Our CWC continues to support people of all genders in the 5 colleges and the Hampshire County community. We provide a variety of services ranging from support for those who have experienced sexual violence to general counseling, leadership opportunities, and more. Our hotline provides immediate support for sexual assault, relationship violence, or stalking. It's free, confidential, and available to any member of the Hampshire County community. For ongoing crisis support, short-term crisis counseling is available for those impacted by sexual or relationship violence. Additionally, specialized teen services are also available. For medical and legal advocacy support, connect with our civilian advocates who can help with restraining orders, individualized safety planning, sexual assault evidence kits, reporting to schools, and/or working with the police or DA's office. If you're seeking ongoing general support, we also offer empowerment-based counseling. Our counselors are trained to support those looking for general or specific assistance, or, when appropriate, can make referrals to community agencies and therapists. We also offer a variety of support groups on topics such as mindfulness, creative expression, and survivor support. They are all offered virtually and are a great way to get support in a group setting. To get involved, check out our workshops and trainings. We cover topics such as sexual violence prevention, healthy relationships, consent, and salary negotiation, just to name a few. This year, we're excited to offer a series of programs focused on economic, reproductive, and environmental justice, so join us. And if you're looking for a supportive community for women and non-binary people of color, connect with the Women of Color Leadership Network. The WCLN provides advocacy, mentoring, programming, training, and a virtual home for women and non-binary people of color to connect. Despite being physically distanced, CWC remains open and available to support the 5 colleges in the greater Hampshire County community. For more information on any of our services or to check out our events, give us a call, visit our website, or connect with us on social media.
Okay. So please, I also want to encourage folks to ask questions. If you have any questions while we are going through our panel questions, if we have time, we can try to answer those here today. And if not, we will be sure to follow up with folks after the briefing after today. So I'm going to just jump into our first question. And Carmen, I'm going to ask if you can respond to this question first. The first question is that JDI, and we've talked about it a little bit here today already through our policy framework, is that we're deeply aware of the intersections that survivorship and disparities. And if we're looking at just the past year, we've witnessed the racially disparate impact of COVID-19. And then at the same time, really as a nation, really reckoning with the impact of racism. And so I'm wondering if you can talk a little bit about the impact of these dual pandemics on survivors that you work with and in your community. Carmen, I'll hand it off to you, and then maybe to Dawn, and then Karu.
Thank you. Absolutely. Thank you for giving JDI for giving us the opportunity to be here. So my name is Carmen Nieves. I have the privilege of being the executive director of Women's Shelter Compañeras, and our administrative offices are located in Holyoke. Our 33-bed shelter is in a confidential location in Western Mass. Holyoke is a city in Western Mass, 40,000, probably 40,000 people. And it is probably one of the poorest cities in the state of Massachusetts. Women's Shelter Compañeras provides linguistic and cultural services to probably the majority of our participants. 70% are Latinx families and communities that we provide these services to. So as I hear JDI's great work and all of the legislators' work, as they look at these bills and as they looked at making these laws, I thank you for doing that and doing this work. It's so important. I do want to remind everyone that for us in Holyoke last year in March, our 33-bed shelter was full. And from one day to the next, we learned about, that COVID-19, the pandemic. We didn't have as much information as we do a year later. And tragically, bodies were being pulled out down the street from where we worked because, with the Holyoke Soldiers Home. And I have to say that it was our alliances with our community partners, the amazing work of our board of directors and our staff at Women's Shelter Compañeras, and even member programs, Safe Passage, I don't know if they're on, YWC of Western Mass, such great organizations that we were able to turn to them during this past year to help us with this work. And your question about the inequities during the pandemic, I think the biggest one for an agency like Women's Shelter Compañeras and our survivors are the language. The access to the language barriers is one. I'm going to let the great leadership of Karu and Dawn talk after me about homelessness and what they see in their communities. And I also want to thank Representative Blaise for introducing the abuse litigation that I hope to talk a little bit about this morning, also to bring to your attention. But for our survivors, it is disheartening that you have to worry about wherever you turn to a state agency, whether it be the police, the hospital, the court system. Not only will I be able to speak the language, will anyone there understand what I'm going through? And that has to stop in the state of Massachusetts. That shouldn't be a reason why someone doesn't seek services. And that inclusion is really important. And not just for Spanish speaking, but for our Russian community. We've had many families turn to the police, hospitals, and other state agencies and had to wait days, not just hours, for interpreters. So that is two of the issues that I'd like to talk to this morning. So I will again say thank you to all our community partners. The alliance that we were able to have before the pandemic is what I think has brought Women's Shelter to where we are today and offer the services and support to our survivors, because our donors our community partners, our sister agencies have been such a help to us. And I publicly say thank you for that.
I didn't know if I was supposed to jump in. So thank you, JDI. So in response to the impact of racism in the pandemic, I also want to bring in and talk about xenophobia in the Asian community that's happening right now and has a long history in in American history around xenophobia and so I think what I want to talk about right now is the rise in Asian anti-Asian rhetoric and xenophobia and the anti-Asian racism that stemmed from our former administration has a history here in the United States and has incited hate crimes, verbal and physical attacks on Asians in the public and on social media for throughout this pandemic. And so thinking about our clients who are Asian, who are immigrants, who are limited English proficient, who are not only experiencing and worrying about their safety at home because services are limited right now and having to deal with the increasing stress of domestic violence at home and not being able to seek help, but then also not feeling safe in their communities, not feeling safe because there's a pandemic right now and this has been going on for a year, not feeling safe about being attacked in the community, being worried about or wanting to, go from point A to point B to go and get whether it's COVID-19 testing or vaccinations, but being worried about going out into the community to go and get that health care and that help that they need. So there's a lot of fear that's happening right now. And there's worry about, even for immigrant communities, about government and about going to the police, and they have very real fears around this, and so they're feeling very unsafe in the community and at their homes. I also want to bring in one more thing. Thank you, Carmen, for also mentioning the language access barriers. That's a critical issue in being able to find safety and find information. But in addition to this, and I'm thinking also about immigrant communities and BIPOC communities, that for our advocates, even who are immigrants themselves, they were just talking about, we just had a meeting recently and talking about, we safety plan for our clients, and we've been re-safety planning for our clients throughout. We're now safety planning for ourselves. We're worried about being in the community. We're worried about stepping out of our house, and so we're retreating into our homes. And so there's this real sense of fear that's happening where you're no longer feeling safe at home, but you're also not safe in the community. And that's really concerning. So I'll just stop there.
Thank you, Don and Carmen. I'm Karu, she, her, they, them. So I work at Habaco. I mean, to add to what Carmen and also Don have already described about how our clients have been experiencing during the pandemic and how they experience racism as well. So at Habaco, 62% of the clients we are working with are immigrant survivors. And during the pandemic, our community got hit so hard. And the client that we are working with, survivor that we are working with, they are low to no income survivors. When the pandemic hit, it's add more layer to that in terms of losing their housing, losing their childcare, losing their food security. So you name it all, right? That survivors are facing. On top of that, they are so afraid of seeking support, especially because they are immigrant, and immigrant has been targeted for years by ICE and also police enforcement. So they are so afraid to even seek out restraining order or even coming to Habaco, because they're so afraid to ask for help from the community because they're afraid of getting deported. They're afraid of getting arrested. So it's adds so many layers of disparity in our community. And being afraid to even go outside on top, like Dawn described, you know, you are not safe, you're dealing with domestic violence, but also you're dealing with other fears and racism within your own community. And it has been very, very challenging in supporting our clients. And poverty is one thing, but also the systemic of racism have the most impact on our clients. And our community has been in a hot spot for a long time, and there aren't enough resources that are coming to our community in supporting survivor domestic violence in the harbor area. And as staff, I can relate it to what you have said, Dawn. As staff, we had to do safety plan with our own self. How are we gonna be safe being out there and supporting our clients on top of the pandemic? And majority of our clients get contracted because they are essential workers. They have no luxury to like stay at home when this state gets shut down. So they have to go to work, and there aren't enough resources to support the families. One of which, another challenges that we are experiencing are technologies. When everybody have to go remotely, so immigrant survivors don't have those access for their children, for themselves. So it prevent them from connecting with the whole world, because what else can you do if you don't have access to cell phone, to Zoom, to Chromebook, to a laptop? You are so isolated on top of isolation already. Thank you.
Thank you so much, all of you. Just before I transition to the next question, I wanted to just share a couple notes from Gisela from Center for Women and Community that she had shared this morning. A couple of the particular impacts that she wanted to uplift today was sort of the increase in issues of sexting during COVID, the way in which blackmail, extortion, revenge porn, that those tactics are happening so much more, and under the cloak of the heavily electronic world we live in, and the way in which some of those intersections are impacting survivors in her communities. And certainly I think this is cuts across, as we know, sexual assault survivors at the intersections of oppression are targeted for violence at increased rates. So just wanted to share that to bring Gisela's voice into this space. Thank you all so much for sharing the impact of these disparities on your programs and really lifting this up. One of the questions that we had was, there's been a lot of conversation about resilience, the resilience of programs, the resilience of survivors as individuals are navigating some of these complex times. So we wanted to ask you, what are some of the strategies your programs are using to address these disparities, to reach survivors right now, when it is so hard, when the challenges are so great in terms of both, in terms of access, in terms of fear, etc.
I guess I'll go first. Karu again. So we have been serving many survivors when we go, when we start working remotely. We make lots of phone calls. We also sending out letters to survivors. We also stop by checking in with survivors. We provide ongoing advocacy through phones. We mail food security gift cards to survivor. We are able to provide rental assistance to make sure that survivors are not becoming homeless. And also staff have been going above and beyond to support survivor to make sure that they get their needs met. We also able to work with the city to get some more funding to support survivor who almost becoming homeless and to pay for their rental assistance. And we bring the community together. We work with many community organizations to make sure that each survivor that comes through different organization, different channel are getting supported. We able to move survivor because we are in a hot spot and we need to depopulate it, survivors. We able to move survivor to hotels. And on top of that, we are able to extend the stay for survivor and then also support survivor in our community who needed a shelter, most of whom that we are serving who needed a shelter at a higher risk of domestic violence, homicide, and we're fortunate to be able to support them. And collaboration is our key work within our community, and also staff also connect with other organizations as well as with the survivor to make sure that we are in communication, we are supporting one another as staff and also survivor.
Yes, Don, did you want to go or can I? Thank you, Karu. So for us as well, I think to add to what Karu has said, one of our programs, MOVA, one of our funders, and thank goodness that funds our Safe Plan program. As an example, we have never stopped being busy with Safe Plan. So even though survivors now have to get their restraining orders remotely, go to their local police departments or to their courts to have them filed remotely. And as you say, technology, if you don't have the bandwidth to do that, the broadband to do that, if you don't have internet access, if you don't have access to a smartphone, an iPhone to be able to do all of that downloading of documents and filling that out, that is something that you're not able to do. And shame on us that you're not able to file a restraining order in the state of Massachusetts if you don't have the technology to do that. So one of our funders, MOVA, again, our Safe Plan program, we probably have about 100 a month. It's still been busy, even though our advocates are not in courts. We're doing all that work remotely. And I think that has to do with our outreach. We have turned our advocates to outreach workers, right? And I know Safe Passage is on, and the great work that they do with outreach and prevention, taking cues from them and how that's done, having conversations and trainings remotely, letting other communities know and people within our community that we're still there to be able, if you need someone, if you need to have a restraining order filed, I think that's so important. And another funding sources that we've been able to identify, our 33-bed shelter is always full, even during the pandemic. And we've been able to put many families in hotels. It's not the best, right? It's not a DV shelter, but we've been able to assist in that way. And we haven't been able to do that unless we had the funding to do so. Dawn?
Thanks, Carmen. So I think I'll start with ATAS, with just describing ATAS a little bit. And we are a culturally specific organization. So we serve a population across the state, and that's the Asian population. So Asian victims of violence. And so the majority of our clients are limited English proficient. 95% of them are limited English proficient. They do not have access to mainstream services, all mainstream services. They do not get information, or access to resources and services in their language. So we, as an organization, let me add one more thing. 20% of our clients are undocumented, who are even more isolated from services, from information, from accessing just safety measures. So a task really does exist to counterbalance inequities, systemic inequities. We do that through our staff. And it is they who bridge that barrier and that gap. It is our bicultural, bi and multilingual staff who speak at native levels, who are immigrants themselves. And as I spoke before, they too are in fear themselves, but they're immigrants and refugees themselves. And that is very intentional that we design our programs like that, because that is the only way to reach these very vulnerable communities. So during the pandemic, they have been the ones that have been the safety net for the state, reaching these vulnerable communities. They have been the ones that have been translating for the unemployment and helping them and assisting them to getting unemployment if they qualify. For many of our undocumented clients, they don't qualify. They have been sharing information about COVID-19, where to get tested, where to go, what the procedures are, because that information isn't getting to those communities. Even now, as I'm seeing those documents being translated, it's not disseminated into the communities. And in those communities, they don't know where to look. They don't know that mass.gov is that site you're supposed to look at. And even if they did, navigating that is just impossible. So they're not getting information, and they're not getting any assistance, and they're not getting any help. And so it's the bi and multilingual providers that are actually doing that work for the state, and providing that guidance and providing information on the moratorium of evictions, and if it's still even a state, and information on courts and where to go and if they're open and what the procedure looks like. And so this really does sit on the shoulders of bi and multilingual providers and culturally specific organizations. And so let me just go back to undocumented immigrants, because I'm kind of seeing that flow through the chat. They aren't getting those same services. So what we've been doing to counteract that is client funds. So thank goodness for all the client funds that have been coming through, but we have been spending average probably about $16,000 a month on client funds at minimum. The past 2 months has been close to the 20s. And we're about to be depleted in those client funds, and the fiscal year's ending, and we don't know what we're gonna do next. And we've been trying to figure out everything else, and we don't know. And things aren't changing right now. People aren't going to get their jobs, and kids aren't going to go back to school. So that if somebody could work, that they could get back and start working right now. So none of this is going to change anytime soon. We're ending the fiscal year, and we don't know what we're going to do next, and we don't know how these immigrants are going to get supported, and our clients are going to be supported. So we're worried. Sorry, passing on.
Thank you all so much for sharing your responses to both of these questions. I think it's so important that we're able to sit here and hear from each of you the really true realities of what survivors are facing across the Commonwealth. I love that between the three of you, you're able to represent the entire state of Massachusetts, and really recognizing that there are many common themes that are flowing throughout the state, but also how they're showing up differently or the same in each region. We've talked about the impact of racism, COVID, xenophobia, all the different themes of language access, housing, how it's impacting survivors, tenfold more now because of the situations that we're in, that were discussed, that already existed prior to the pandemic, and the xenophobia and the increased racism, I think, that we're seeing in this country. And really the resilience of all of you and all of your staff, also the staff at all of your programs, to continue serving survivors during this time while also having to care for themselves. And I think it's important that we recognize the individual trauma that advocates carry, and also the vicarious trauma that they carry working with survivors every day. So I really want to open up this question in the next couple of minutes for the three of you to really speak to all of us and speak to legislators and staffers who are still here right now about what are the necessary policy or systems changes that you think we really need to make in Massachusetts to make our systems work better for survivors, how we're able to provide support that it's equitable and accessible for every survivor, regardless of their identity. So Dawn, if you don't mind starting us off with that question. If not, feel free to kick it to someone else.
I could start. I mean, I have a couple of things, so I'll just lay them out. I think there are a couple of things that we can do, that we need to do, and that's been highlighted throughout what Carew and Carmen and I have been talking about. And one of those things is definitely language access. Without a doubt, language access, meaningful access in courts, in law enforcement, with DCF, with DOR, crisis intervention, DMH, in schools. We had a client who had been going to IEP meetings and had no idea what was even happening in this IEP meeting and signing off documents that they don't even know what they are. That's just insane in my mind. And from start to finish, to have language access from start to finish, meaningful language access. And the language line is not a meaningful option. Having just translators and interpreters is not a meaningful option. You need providers who are able to do this work from start to finish. So another thing would be data equity. Aggregated data masks the needs of critical and underserved groups. And I think we need to think about that. Also, I think what I'll end on before I kind of move this on is to be thinking about centering transformative justice that begins with a cross-racial dialogue and community building that addresses white supremacy and the root causes of violence and hate. And when I think about this, BIPOC communities, Asian, Latinx, immigrant, LGBTQ, limited English proficient, just don't have equitable access to services. And we need to think about this. They're not being treated well, just bottom line, not being treated well. And we need to think about expanding civil rights protections, increasing education and equal access to quality education, ensuring equitable access to resources, opportunities, and services. I mean, we can do better. So I mean, I think I'll pass on from there, but thank you for the space.
Thank you, Dawn, so much for your leadership at Carew, and for all of you. And as you're talking, I'm like, yes, yes, yes. But the first thing I'd like for legislators to hear is please turn to, JDI, Adrian and Hema, turn to them. Do no harm first, right? Unintended consequences for some legislation and some work that is being done. Please turn to JDI for that, and also turn to your local domestic violence and sexual assault program. We would love to take these questions from you and meet you at your offices or through Zoom or at our offices. It's really important. And one other thing, the gun control, right? I mean, there's so many other substance misuse, and what we see in Holyoke, the lack of Spanish speaking therapists. I mean, for children, for survivors. I mean, there's just so much that we need and it will continue to advocate for. Carew?
Sorry, thank you, Dawn and Carmen. And I also want to thank our representative and legislator who've been our ongoing support for this work. I give you a big applause. And JDIs and Adrian and Hema, you guys rock. And Deborah Robin, you such an amazing leader. Thank you so much. And all the community programs that are here. To add to what Dawn and also Carmen already have spoke about, I want to make sure that there are more affordable housing for survivor of domestic violence. And I also encourage all our representatives and everyone to look at a comprehensive solution to end domestic violence. It's not just housing. We need affordable childcare. It is important in order for survivor to build stability, to move on, to get all the support and healing. You need affordable childcare. And my other thing is that prevention and intervention is a hand-in-hand process. You can't just pull money from prevention to give to intervention and vice versa. It needs to happen both. Because the harm already been done to survivor, we need intervention. And in order to overcome, to end domestic violence and sexual assault, we need prevention. So it's a parallel process. And my other request is that police reform is needed. And we also need to support who come out and challenging the system, the police enforcement, that they're not gonna get fired. That creating space for change and creating space for, we rely on the police too. We're not targeting police, but we wanna make sure that we work collaboratively, and also that we wanna make sure that we promoting survivor centered. And what does it mean? And in order for survivor to access support from the police department, there need to be a reform. So those are my requests. And I appreciate all of you for being here and listening to the work that we are doing with the survivors. Thank you.
Thank you all. Since we have a couple more minutes, I just wanted to open it up to any of you to, if there was anything else that you felt like you didn't quite get to share, please feel free to weigh in now. We have a couple more minutes. We'll also take a look at the chat and respond to questions that might be arising there. But just while I'm doing that, if you all wanted to take a look, feel free and share. I wanted to share anything that we've left out.
I mean, I think I would add one thing about judicial accountability and mandatory training on SDV and cultural competency and diversity for the bench. I think training is super important. And I think that that's another thing that I would add.
Oh, one more. I would like to add one more thing. I forgot. We need to decriminalize the sex worker as well. Instead of criminalizing the sex worker, we should go to the roots that causes that, and holding PIM and others leader accountable.
So, oh, I don't want to jump in if anybody had a question.
Go ahead, jump in.
I had said thank you to Representative Blyce earlier for the abuse of litigation. And I just wanted to take a few minutes for, if anyone here is from that office, that we have had in the past year, before the pandemic, we saw many survivors being dragged to court for many, many times. We've had one survivor that was made to go to court 37 times in 6 months. It was very obvious of what it was. So the Massachusetts bill that's being considered now is based on the Washington state law that recently passed. So I encourage all of you to please look at that. I am so afraid that when the courts start opening up and we start going, to business as usual, that abusers are going to be using this tactic way more to get to get survivors and victims of domestic violence and sexual assault into court, because they lost that right with the courts closing. So I just wanted to take an opportunity to legislators to know that our judicial system does have a lot of say in what happens in our court system. Let's take the opportunity now and rebuild it correctly. Let's take the opportunity now to look at this legislation that is in front of you and see if that we can head off this tactic that many abusers are using. Thank you.
Thank you so much. And you'll see that the language for that bill is still in development. It is modeled after the Washington state law. We are working with a coalition of, brilliant family law folks to weigh in on how this is going to make sense in Massachusetts. Feel free to reach out to Adrian or myself or our friends at Mass Law Reform Institute for further engagement in this. The final language should be ready very soon. I also wanted, as I'm looking through the chat, I just wanted to uplift a couple notes from some of our sexual assault specific programs. I see Katie Tyler from Health Imperatives who says that she wants to acknowledge the harm being done specifically to sexual assault survivors within the context of the pandemic, seeing a heinous abuse and complex trauma, and just uplifting the reality that services specific to survivors of sexual assault are vital. And similarly from Lizetta Harge-Putman at Independence House, just a reminder that sexual assault survivors need access to services and support. And absolutely, JDI will continue to uplift the critical needs of increasing funding for sexual assault survivors, maintaining those that life-saving investment, as we mentioned earlier. So thank you all. I also wanted to just uplift a comment from Marianne Winters in the chat. I encourage us to add an awareness of the needs and intersection of people with disabilities and those living in rural communities. 80% of our clients have either a long-term disability or chronic health condition that impacts their ability to navigate systems. Thank you for illustrating that. And just that is in the intersectional approach that we take to this work. That's precisely why, because survivors live at the intersections of multiple forms of oppression. So thank you so much for sharing that. Adrian, is there anything else that I'm missing from the chat? I know we have about 10 minutes left, and I'm happy to move to our closing remarks, but just wanted to see if there was anything else that either you or Deborah noticed in the chat that we should be uplifting before we close out.
I think you captured everything that I saw, and I just really do want to acknowledge, I know our panelists today were all domestic violence service providers, but really acknowledging and uplifting the impact of the pandemic on survivors of sexual assault, and recognizing that there are unique impacts to survivors of SA, that oftentimes it's easy for us to lump together survivors of DV and SA, and really just reminding us that it's important to really parse those two groups of folks apart, and acknowledge that Joe Pang did raise that in the chat. Joe is from Newton Wellesley Hospital, that survivors of SA are facing unique challenging in terms of also obtaining housing, economic security, and many of the systems that survivors do work with. So just wanted to uplift that additional piece.
Well, thank you all so very much. I am just so honored to be in your presence, all of you. Thank you for your wisdom and for your sharing. I mean, Carmen and Carew and Don, your work is just so powerful, and Gisela in spirit, I know she deeply wanted to be here. We are grateful to each of you, and just a round of virtual applause for these fabulous leaders and the advocates who support their work each day. Just wanted to do a huge thank you to everyone here with us in this Zoom space, or those here in spirit from our member programs and partners. You are part of this collective work to end sexual and domestic violence. And to the advocates in the room in the coming weeks and months, please do share your stories with your legislators. This was sort of a grounding in the what and why we do the work we do. So share these stories, share your priorities, your experiences, what you feel, local community-based wisdom is what makes change, and you have that. So we encourage you to reach out to your legislators and share these stories. And to our legislators, please do continue to reach out to your local programs, of course to JDI, but more importantly to your local programs to learn what's happening for survivors in your communities. This is community building. And as Adrian had grounded us in community engagement. This is community building and engagement. This is civic engagement. This is social change. And it's truly a pleasure to be building community with all of you. So thank you. Thank you to the whole JDI staff for providing so much behind the scenes support for this event. And of course, to a big thank you to our ASL interpreter and our CART captioners. Thank you for creating a space that is accessible to all.
Whose intentions are good.